Good evening, everybody. Thank you for joining us for session 4 of our Aging and Elderly series with the Link family. This is session 4, and our topic today is bone and muscle health in the aging. And I'd like us, if you're not speaking, please mute yourself as you come in, please. You have any questions, there's going to be a time for that, which will be at the end of the session. We'll have an introduction to the Link family, which would be towards the middle. We'll just give Dr. Badmus a breather in the middle of his presentation and then just say a brief introduction of the Link family, and then he can continue. And then I'll let us get into it right away. Okay, I'm happy to say our speaker for today is in the house. He's Dr. Olakunle Badmus, and I'll just be reading his introduction now. We still have time to invite people to join us for this evening's meeting, which is going to be a very, very interesting one. And it's going to be live streamed on YouTube for those who might be unable to get into the Zoom. Mr. Badmus, are you able to show us your face, please? While we go through the introduction. Hello, Mr. Badmus, are you there? You're muted. Hello? Hello, Mr. Badmus, can you hear me? You're muted.
Hi, yes, I can hear you. Sorry. Hi.
Okay, can we see your photo, please? Your video, please. Thank you very much.
Hi. Hello, everybody.
Hello, sir. Okay, so Dr. Olakunle Olaleke Badmus is an orthopedic traumatologist and spine surgeon dedicated to delivering patient-centered, high-quality surgical services in Nigeria. He worked for almost 2 decades at the Lagos University Teaching Hospital, one of the nation's foremost tertiary health institutions, as a senior consultant orthopedic and trauma surgeon, and served in various leadership capacities, including being the first head of the Department of the Accident and Emergency, where I met him. In more recent years, after taking voluntary retirement from public service, he has taken time to focus on his spinal surgical practice and his family. Over the last 4 years, he has worked as a visiting consultant spinal surgeon to provide surgical care in hospitals in Lagos and Abuja, where he has performed over 250 surgical procedures with great success. He also provides specialist surgical care in private cancer centers. His passion for building capacity through teaching, training, and research in resuscitation, which includes basic and advanced life support and the delivery of emergency care in major trauma, has been a driving force throughout his career. Since 2016, he has served as national faculty with the AO Trauma and AO Spine organizations in Nigeria on numerous courses. When he's not working, he enjoys spending time with his family and close friends, traveling, watching a good movie. He's a fan of James Bond, and taking long drives with good music. I have worked with Dr. Badmus, and he is an enigmatic personality. And he wrote a lot of references for me when I came to the UK. And I must thank him especially for that, for his support. Welcome again, Dr. Badmus.
Thank you, Dr. Ayedem.
So over to you, sir. The floor is yours. You can take a break in between when we will introduce the Link family, and then you can have a drink of water and continue right after.
All right. Thank you very much. I hope everyone can hear me.
Yes, we can.
I first of all make an apology because I mostly have made presentations in strictly professional circles, and I might struggle a bit, but obviously I do talk to people in clinics and around hospitals on a regular basis. So I try to make what I'm going to share and break it down. But I think that sometimes there's a lot of ideas out there in public that are unfounded in facts or in what we know. So I'm going to try to provide a real sort of scientific basis for the advice that we will give or we will discuss. So I'll start sharing my screen right away. All right, so this talk is about muscle and bone health in the aging. I prefer to say getting fit after 40. And I emphasize that because it's always best to start early before the changes are some ways along, but it's never too late. So basically, we've got everyone has bones and muscles. They might be difficult to see in some people, but they're there somewhere. Essentially, for the science part of it, a muscle is just a bundle of fibers. Obviously, it's a living entity. It's got blood supply, it's got nerve supply, and it moves, it shortens, it contracts. But muscles are just bundles of fibers that have a very intricate microarchitecture. Essentially, over the lives of an individual, we are not going to increase the number of fibers in most situations. So essentially what you have is whether the fibers get bigger or they really get smaller. And when they get smaller, we call that atrophy or shrinking. The bone is also a living tissue, even though it is rigid. It's got an intricate system of bone cells and a lattice of basic bone microfiber, which we call the osteon. And because it's got blood supply, it can repair itself when it is damaged. And the damage is not always a big damage, as in when the bone is completely broken. Through the course of our lives, there will be, on a day-to-day basis, literally, small damages here and there that the body will repair. And also, the skeleton and the bones in our bodies are adaptive. Not only do they grow as we get from when we're born and we go through our youth, they increase in size, they increase in thickness, but also they adapt on a day-to-day basis to what we do or what we do not do. And that is going to be very important in some of our considerations. And so, like the muscle, bone has its own cells, and they're essentially about a basic of 3 types of cells in most bones. There could be more. There's a cell that sort of maintains the bone environment and coordinates between the other 2 types of cells. And then there are the cells that we call the osteoblasts, that they make bone or they lay down new bone. And then there are those cells that sort of remove old bone or damaged bone. And the interesting thing about bone is that through the course of all our lives, all these three cells are present and constantly working. And essentially, when we're growing from little babies into the strapping young men that and young women that we were at some point, what we experience is that the cells that make and lay down bone are working harder and doing much more than the cells that remove bone. So bone is in a constant state of equilibrium. And that equilibrium only swings at certain points. So when we're really young, the equilibrium is in the favor of the laying down of bone, and therefore our bones increase in length, they increase in thickness, they become heavier and sturdier. But once we are getting into the age around 40, that equilibrium becomes balanced. Probably from about 30, actually. It becomes very balanced, and we're neither gaining or losing bone. But once you reach about the age of 50, certainly for both men and women, we really start to lose bone mass at different rates. And there are reasons for that, which we will maybe talk about a little bit. So bone is living tissue. It's constantly adapting to our activities, our lifestyles, the things we face, constantly healing injuries, micro injuries, small injuries here and there. And the same thing with muscle as well. When people sort of do something strenuous and they start to have some muscle pain, usually it is because certain muscle fibers have been injured and there's some inflammation in the muscle. And then there's a repair process that will go on. And when that inflammation settles, that repair has been completed. So these tissues are living tissues. The functions of muscles generally is for locomotion. All movement is initiated by muscle. And there are three types of muscle in the human body. There's the skeletal muscle, which is the muscle that basically is connected to the higher centers of the brain, which we can control in a state of awareness. We can voluntarily control our skeletal muscles, so we can move our hands, and it's those skeletal muscles that do all of that. There's another group of muscles that is striated and similar to skeletal muscle, but that's the cardiac muscle. Well, the cardiac muscle is very special because it's got a bunch of special cells embedded within it, so that it is disconnected largely from the conscious brain. We don't control our heartbeat. The heart just sort of keeps on beating on its own, but the heart itself is a muscle. And then there are these things we call smooth muscles that generally line our organs. And so, for example, when we eat and then the food goes down and goes through all the aspects of the digestive tract. It's the muscles of the gut of the gut that is moving all of this along. So all movement is because of muscle function. Muscles are also very important for maintaining posture. There's no way, if you know what the human skeleton looks like, that if you stood a human skeleton, that it will stand against gravity. So no matter how intricate and how extremely complex the human skeleton is and its in its articulation, even with all the ligaments and stuff that keep the joints together and the capsules, it would not stand without the muscles. So the muscles are really the reasons why we're able to maintain an erect posture. Muscles are also responsible for breathing because the chest wall has to move, and that's how we breathe. And the muscles do that. So the cardiac muscle pumps blood all around the body. And then the skeletal muscles are very important for maintaining glucose metabolism. And that's because they are the largest consumption organ for glucose. All right, so what's bone for? Bone is a structural pillar of the body. You know, the bone is the rigid tissue that, you know, gives form and structure, the basis of our look and all of that. And it acts as a scaffold for the muscles. The muscles don't exist in air. They have to attach to different parts of the skeleton. And then the skeleton is also like a cupboard and a hanger and a protective casing for the organs. So the brain is hidden in the skull, the heart is hidden within the rib cage, you know, and these organs are protected. But certainly, even the bowel and the gut, all hanging from the spine by different attachments. So the skeleton really is that basic foundational structure on which everything is sort of layered and hangs. And then it also functions as a storage for vital elements like calcium and phosphorus that is very critical for the functioning of nerve, brain, muscle, tissue. And of course, the bone marrow makes blood components. So basically, this picture, if you look at this here, is just an illustration of, for example, how the spine is able to function. So we compare the spine to a pole. And we know that, you know, like if you look at those telecommunication poles and those long masts, if you put that in the ground, no matter how well you put it in the ground, the higher up it goes, the more flexible it becomes, you know, and it can never really be stable. But when you put trusses of cables down to the ground, it becomes an extremely stable structure that is able to withstand all of the winds and all of that. And that's exactly what the muscles do for the skeleton. They stabilize it. And so our balance and our equilibrium, our ability to maintain an erect posture, despite, you know, sort of changing direction and leaning, is inherent within not just the skeleton, but actually the muscles that are hanging off the bone. So this is not just a structural integration. These tissues interact in an intimate manner in the body. They produce chemicals. They produce chemicals and they respond to chemicals that are produced by other organs. So we talk about, you know, the different aspects of the body send signals to each other. And the signals can either be sort of, in lay terms, like electrical signaling, as with the nerves to the muscles, although even that is actually carried out by simple chemicals that are released and act on endings and things like that. But at the same time, this signaling can be directly by chemicals. So we know, for example, you know, there's a chemical called estrogen, which we call a hormone. And a hormone simply is just a chemical that is produced in one part of the body, but has its action in another part of the body that is a little bit distant from where it is produced. And these hormones are very critical for maintaining bone mass, for ensuring that we build more bone rather than lose bone. And that's sort of like what we have, you know, so there's that sort of very intricate chemical interaction constantly going on between muscles, bones, nerves, and the different organs. And those interactions form the basis for some of the things that then happen as we grow older. So we have referred to these as sort of internal influences on muscle mass and function. And once you are over 50, as a man, probably the greatest influence for women is estrogen, in terms of chemical signaling, estrogen. And this is a bit of an interesting thing, because we know that women, most women by the time they're 50 will be menopausal. And with menopause comes usually or often a decrease in the amount of estrogen that women produce. So if you measure estrogen levels in a postmenopausal woman, it is usually significantly less than a man of the same age. Men also have estrogen. And estrogen is actually the reason why men's bones are stronger. They have, estrogens have a greater impact on bone and a more direct impact on bone than do the androgens or testosterone and company. And so it is the lowering of these hormones in this phase of life that leads to a decrease, a gradual decrease in both muscle and bone mass. And because of this menopause in women, that event is significantly more pronounced than it is with men. So on the average, we would expect that the bone mass of a man would start to reduce without any intervention by about 10% every decade, which is very significant. So basically, internal influences on bone, we know that there's a constant exchange of calcium in particular, because the bone is the store of calcium. You need a regular intake of dietary calcium, but we actually excrete quite a bit of what we take in. A bit of it is absorbed and goes circulating between the blood compartment, soft tissues like muscles, because for the contraction of muscle, calcium is very central to the functioning of nerves, to the transmission of nerve signals or action potentials or electrical currents in the nerves. Calcium is very critical. And the bone is the big store of this calcium. Each kilogram of bone contributes about 500 milligrams of calcium going in and out on a daily basis. And there are quite a number of hormones that also have influences on bone. But like I said, once you are over 50, it basically is about estrogen and testosterone. For those with thyroid problems, that can also have a significant effect. And then people who maybe for some reason or the other have had to start to take corticosteroids for some autoimmune or inflammatory disorder, or sometimes just wrongly prescribed, as I often see in my clinic for pain conditions where some people think that maybe corticosteroids are better to use. Because if you've been on corticosteroids for persistently for about 2 or 3 months, then you have great risk of significant muscle and bone loss. So what are the negative changes in muscles with age? But it isn't just with age, with aging, even just disuse. So even if you're sort of like in your 30s and you, for some reason, have begun to live a sedentary life, you will start to experience the same thing. So this is not just initiated by age, it is also initiated by disuse. And of course, like we said, it can be initiated by any of these other internal influences, the hormones and things like that, should they abruptly decrease for some reason or the other. And this changes a gradual decrease in the mass of the muscles. The muscles just start to shrink. We have a name, we call this sarcopenia. and the muscles shrink in their size. If you do an MRI scan of muscles or a sample of a person's muscle is caught and examined, you see significantly a lot more fat infiltration into the muscle. So rather than just beefy muscle, you start to get muscle with a lot of fat deposits in it. The muscle strength is demonstrably reduced, or it demonstrably reduces. So if you use things like grip strength, it just reduces yearly once people are over 50 and not doing anything to actively prevent it. That's what's going to happen. And of course, because the muscle function is poor, the muscle mass is reducing, glucose uptake is significantly reduced. And that then means that any glucose intake, the ability of the body to deal with it is now compromised. And this is why type 2 diabetes tends to now show up more once people cross this age threshold. And of course, we've just also seen that there are increase in inflammatory markers for some reason or the other. And this is now more tied to a decrease in the level of estrogen. But like I said before, that decrease in the level of estrogen occurs more significantly in women than in men. Now, all of these changes in the muscle and the bone, a bit more complex than this, but I've just tried to summarize it. They can be reversed, or they can be, or that effect can be reduced by one of several things. Either people are placed on hormone replacement, but typically the indication for hormone replacement is actually different. I'm not aware that there's any stipulation or guideline that says, you know, to prevent loss of muscle mass or loss of bone, that women should be placed on estrogen replacement therapy. But it probably is a good reason as any. The other thing is exercise, and that's something that obviously is within the capacity of everyone. You don't have to go to a GP or to a hospital or to see anyone to engage in exercise. So exercise is just sort of like ubiquitous. It's like water. It's there with you every day. The day you wake up, the moment you wake up, when you're going to bed, you have the capacity to exercise no matter where you are at. Intake of calcium and vitamin D, and also good intake of protein are all things that help to forestall the unraveling of the muscles and the bones or to reverse them. So if one doesn't do anything and these muscles sort of become flabby and the bones gradually become, they lose their mass. If you look at an osteopenic or osteoporotic bone, which is the term we use when bone has lost mass and is reduced in its mineral content, and protein content, everything across board is just reduced. So if you weigh the same bone, it still looks the same. But if you weigh it in a weighing scale, it just weighs less and less and less. You know, so the bone becomes more fragile and more brittle and easier to break. And essentially, so we know that as people get older and get into this situation, they are at greater risk of fractures because their bone just no longer able to tolerate trauma or stresses or forces like they used to. But there are other reasons for it. One is a reduced performance capacity of the muscles. Say, for example, just the ability when startled to regain balance is lost. So a lot of older people, if they are startled, they actually just fall outright because they can't make those adjustments. Their muscles lack the ability to generate the right amount of force within the short time frame. Cardiovascular capacity deteriorates. You know, the ability of the heart to pump well, to beat faster for prolonged periods of time is just reduced. There's postural decompensation, and posture is largely because of muscles, because as I said, the reason we are able to stand erect is because of a lot of heavy muscles in the back, the muscles in the buttock, the muscles of the thigh. This is actually the reason why we're standing erect, not so much the bones. The bones provide the scaffold. So as muscle function deteriorates, posture deteriorates, people develop deformities. We used to think that spinal deformities were essentially because people had fragility fractures or because they had degeneration. It is now, after we've designed treatment that failed a lot of times, that we've realized that the muscle component has been underestimated. And when somebody has sarcopenia and the muscle isn't functioning very well, they don't even do well with surgery. So rehabilitation, prehabilitation is now a big thing. Of course, we talked about increased risk of falls because of poor muscle function. Of course, it can be other things. There can be neurodegenerative disorders. There can be balance problems and stuff like that, which need to be figured out. But generally, just from the poor muscle function, there's an increased risk of falls. So what is physical fitness? Because that's the term that sort of captures the functional capacity that people have from having healthy muscles and a healthy skeleton. And of course, a healthy nervous system, you know, we can't take that for granted, but that's not really sort of the focus of this conversation. So the US Department of Health said it's the ability to perform physical activity. You know, it's that what gives you the capacity to continue to perform physical activity. WHO went a bit deeper in trying to say, okay, physical activity, you can now divide it into things that are like performance-related activities, you know, not things you do on a day-to-day basis. Say, you know, you want to run or you need to run, because sometimes you don't want to run, but you have to run. Or you need to climb something or jump down from a height. That those are not day-to-day activities. So there's the ability to cope with the demands of daily living, to go to work, to do this and that. And if once you are over 50, I know Dr. Ayedun is not yet there, but sorry, Temitope, I designed that one just for you. But once you're over 50, you already will see a significant difference in your body. So it's not just the capacity that decreases, but say, for example, you are able to do the things that you used to do. Suddenly, the amount of time you require to recover from those activities is significantly longer. You know, so for example, you know, you go to a party and you dance like you used to dance with your friends. And, you know, before, when you were, you know, in your 20s and 30s, you didn't even sleep, you know, and you were okay the next day. Now, all of a sudden, you know, you do that, you come back home, and for 3-4 days, you're just slow. There are pains, there are aches. You don't feel like going to work. You feel like the world is crashing. And it just takes time to recover. And that's what we're talking about. There are several components of being fit. Of course, we talk about there's physiologic components to it. There are metabolic components to it. You know, just your organs being able to do the things that to carry on the biochemical processes that are necessary for generating energy, for clearing waste, and all sorts of things. The integrity of your skeleton, you know, having a good bone mass, having good mineral density, your bone being able to cope, and of course, having a good blood supply and being able to repair itself. And then there are things that are health related, your cardiovascular fitness, your flexibility. And we all know that we lose flexibility as we grow older. We just get stiffer and stiffer. But is this inevitable? These are some of the questions that we're going to now go and answer, because sometimes when we say these things happen, it sounds like we're saying, well, you know, there's nothing I can do. I'm growing older. And, you know, when people get older, they just get stiff. and they get to have less capacity. So, I can't do this anymore and I can't do that anymore. And there's a sense of helplessness that can come with age-related changes. We lose agility, balance becomes compromised, coordination is reduced, power is definitely less, speed is less, reaction time becomes so much longer and stuff like that. But this is the real question. Is there anything that we can do about it? And the answer, thankfully, is yes. The only challenge is that it does take time. It takes time because whatever we do is going to be an attempt to re-engineer metabolic processes. And metabolic processes, when we see the manifestation, when we feel the loss of capacity, when we see the reduction in the bulk, that isn't something that happened overnight. That is something that has evolved over years. So if we're going to stand any chance at reversing it, it isn't going to be overnight. It is going to be a long, hard road. And the things that we can do include good sleep. Sleep is when a lot of our tissues regenerate. Sleep is when children grow taller. And that's why you see there are things we call markers of growth, some things we see on x-rays. And typically when a child has been ill and has been immobilized for a prolonged period, we see a significant, these markers present in their bone. So during sleep, a lot of things happen, a lot of reparative processes. And I think that generally is now agreed that, the minimum amount of time that one should sleep on a regular basis is probably about 7 to 8 hours. If you're sleeping less than 7 to 8 hours on a regular basis, you're in chronic sleep deficiency. That is not good. Diet is very important. Macronutrients, particularly protein, very critical. Micronutrients, vitamin D, at least 500 international units every day, maybe more, depending on what your vitamin D levels are. And of course, calcium, very, very important. Calcium and vitamin D, just taken on a regular basis, we know that significantly reduces the loss of muscle and bone mass on its own. So even if you don't do anything else, and all you start to do is take regular calcium and vitamin D, the reduction in your muscle and bone mass is going to be a lot less. Health status surveillance checks are important. The reason they're important is because it is easier to prevent things or to catch them when they're really not a big issue and to deal with them. We say that, exercise can prolong life, but, there are things that if we miss out on handling properly, exercise will still make things better.
Sorry about that. Still trying to locate you that.
Okay.
I think it's gone now.
Yeah, so exercise will still help, but it is important to just look after one's health. And one of the things that we regularly see is neurologic disorders that people just assume that this is just part of aging. So regularly I have people walk into my clinic, they are toxic, they are unsteady in their gait, they've had repeated falls, and it's been missed that they've got some cord compression in the neck, or they've got some neuropathy, so the health checks are important because there are things that just need to be dealt with to provide a platform and a better chance of remaining fit. Work-leisure balance is very important. And then lastly is exercise. So I'm just going to spend a few slides to talk about exercise. I think I have maybe just about 10 more slides. So I just give Dr. Ayedun Temitope that break she requested for now.
Thank you very much, sir. So you can stop sharing briefly. I don't know whether you noticed that it's not in slideshow. So maybe when you come back, you put it in slideshow so it's a bit bigger for us to see.
Oh, okay.
Thank you, sir. Okay. So big welcome again, everyone. Thank you for joining us on the Zoom. Big thank you for joining us on the YouTube channel. This series is the Aging and Elderly series being hosted by the Link family. And I'll just be telling you briefly about the Link family for those who are joining us for the first time. So the Link family is an amazing online group open to ages 16 and above, aimed at healing and building healthy and healthier relationships. That's all relationships across board. So we help you in gaining insight into your relationships, marriages, parenting, and life, encouraging you to healing and wholeness in every aspect of life. It comprises of young people, singles of all variations, the married and older adults from all around the world. I think the oldest person we have in our group is in her mid-80s. I have personally found the Link group to be an amazing place. There's so much wisdom on there. There's lots of humor. There's lots to learn. So it's an amazing place to be. And you're welcome to join. Please invite your family, invite your friends to be part of us. On a daily basis, we have a theme for every day. One day it's health, another day it's for the singles, another day is for the married, another day is for the children. So there's something to do there's something for everyone. You'll find whatever would fit you on there. We have meetings every week, usually on a Friday by 9 p.m. But because of the series that is going on at this time on Saturdays, we are just having one Friday meeting in a month, which is a prayer meeting, and that is ongoing at the end of each month. So we had one just yesterday. We're having one at the end of July, last Friday of July, last Friday of August as well. We have had previous series on relationships, parenting, blended families, fertility, and now this one. And it's been an amazing time since we started. If you've not had the opportunity to be with us from the beginning, then you need to listen to the previous episodes. You're going to be so inspired and encouraged and willing to change different things and plan for things in your future. So please look at the YouTube channel. One of the Link officers would paste the details on the group now. So there's a YouTube channel. Kindly subscribe. The previous series are on there. The name of the YouTube channel is called Temitope Praising Child. Our online group is on WhatsApp. The link is also on the chats. And the Link family was started by Temitope Ayedun in the year 2020, also known as the Praising Child. And if you'd like to join the Link family, you're welcome. We'll be so glad to have you. And I'd like to say that all our speakers have graciously agreed to speak to us free of charge and out of their very busy schedules. And for that, we are immensely grateful. Thank you all for being here. Over to you again, Mr. B. Mr. Badmus, are you there?
Thank you. I'm here.
Okay, sir.
Thank you very much. Just going to resume sharing. All right. So I'm going to go into exercise therapy. What is exercise? Exercise is basically leisure time physical activity that one engages in with the sole purpose of improving physical fitness. That's just what exercise is. It's a physical activity or a series of physical activities that one engages in one's leisure to improve one's physical fitness. Obviously, it is not something in isolation, which is what I was alluding to. Obviously, physical activity is itself a byproduct of physical fitness, but the ability to conduct physical activity or to be physically fit is also dependent on one's general health and well-being. And any of those can be impacted by so many things. Yeah, so it's nothing to be taken for granted. But the fundamental truth is, irrespective of one's health or well-being status, everyone can engage in some form of exercise or the other. It may have to be tailored. There may have to be some alterations, but everyone can engage in some form of exercise or the other. And as a general rule, exercise across board increases the outcomes in all situations. Age and sex, genetic predisposition obviously influence physiological response to the intention to physical activity, and also performance, particularly when it's aerobic exertion. We see that the Kenyans and the Ethiopians are far better marathoners on a general basis. We see that people of the Black race seem to be significantly better at sprinting, particularly the short sprints. So there's a fair bit of genetic predisposition when it comes to the consideration of performance. We know certainly that female values for performance are on the average about 25% lower than male values. And that's just a trend. And that's for many reasons: anatomy, physiology, and things like that. We know that in apparently healthy individuals, irrespective of non-modifiable factors, engaging in regular aerobic exercise significantly improves physiologic function and performance. It doesn't matter where one is. Exercise makes a huge difference, and it does so in many ways. So once one engages in regular physical activity, I've got here a long list of all the conditions, chronic conditions that exercise improves. It decreases the relative risk of death by up to 20 to 35%. Once you have any chronic condition, whether it's related to the musculoskeletal system, lungs, exercise improves outcome. And exercise has positive effects on cognitive decline. Or to put it simply, it prevents, it delays a decline in mental performance. People who exercise regularly, who engage in exercise regularly, just do better in terms of their mental performance for longer. And of course, we know that it has an impact on depression. For some reason, one completes a task or a goal or achieves a milestone, whether it's on a day-to-day basis, just completing your 30 minutes on an exercise cycling routine. It releases endorphins. It releases chemicals. It changes the brain's pattern, and it significantly reduces the risk of depression or the impact of depression. Types of exercises, there are four main types of exercises. There are aerobic exercises where they just engage in a rhythmic activity, usually sort of low to medium intensity. It can be something like jogging, brisk walking, or cycling. And the benefits are largely or primarily cardiovascular because it gets your heart rate up and it sustains a high heart rate for a prolonged period of time. Typically, you want to do these exercises for a minimum of about 20 minutes to an hour. But the recommendation is that, in a weekly basis, you should do about 150 minutes on a weekly basis. So that's 5 30-minute periods of exercise. Then there are resistance exercises, or what some people will call strength exercises, using weights, using bands, anything that your muscle has to work against. So it can be lifting weights, it can be pulling cables, flipping over a tire. There are different ways to go about resistance exercise. It can just be body weight squats, just half squats done repeatedly. And they improve muscle bulk, they improve muscle strength, they improve balance and coordination. They definitely have a significant impact on bone density over time. And the recommendation is to train major muscles 2 to 3 times a week. And that's about 30 to 60 minutes of resistance training. Then there are flexibility exercises, which is just basically stretching your joints. And this is the reason why people become inflexible, because as adults, we just get to the point where life is about sitting, standing, walking slowly, sitting some more, lying down, and then they're just joints will never really move to their full range, and we know that the more you keep a joint within a limited range, the more it loses out of range movement. It becomes stiff. It just is nature. So the stiffness is not invariable. It is simply a product of our decline in activity. And so regular stretching, targeting, if possible, if you have the time, all the joints of the body will significantly improve flexibility. And once your flexibility is improved, your risk of having injuries, particularly muscle sprain, muscle tears, is significantly less. Your balance is improved. And the best way to do some of this is just to stretch, just stretching, dynamic stretches, stretches before workout, stretches after workout, stretches before going to bed, stretches when just waking up. They help a great deal. And then, of course, there's functional exercises. And functional exercises largely target balance and coordination. So we're talking about things like, push-ups, and there are different grades of push-ups. I see some push-ups that I know that the time has passed, kind of thing. So there are just different kinds of push-up. There's a push-up for every age. So no one should say, no, I can never do push-up. There are push-ups for every age. And the interesting thing is that if you start from the simplest and the lowest grades of push-up, by the time you're able to do that over some period of time, you find yourself able to do some more demanding types of push-up. All right, so move on from that. Physical activity pyramid, this one is probably not clear to you. So on the lowest step would be things like things you should do daily, just moderate physical activity, lots of walking, using the staircase instead of using the lift, doing house chores. And I think that this is, they used to say that women had a longer lifespan than men. And there was a whole story built out of women have more tolerance to stress. But I don't think that is true necessarily. I think it's just that a lot of women through their lives stay active. It would not be unimaginable to see women, even in their 60s and early 70s, still going to the kitchen to cook. And the men largely became, chairmen. When I say chairman, I just mean, the combination of chair and men together. Or they became potato couches. They sat down watching TV while mommy and the kids and the house help ran around the house and did stuff. And that engaging in physical activity is the reason why women stayed fitter. This is just my theory and my thinking. And I think it's just important to pass the message across that it's important to stay active. Okay, so that's the basic. That's like, and I know people who go like, oh no, but I walk all the time. No, that's not enough. That's just basic. That's just basic. It's good to do that, but you need to do other things. And other things would then be, the next step will be to pick up either cycling, swimming, jogging, or use some form of thing that, aerobics, do some aerobics. And the minimum you want to do aerobics is probably three days a week, and you want to reach a target heart rate of at least 60% higher than your baseline, so lots of numbers and things, but just get into doing something. I think I will explain some principles to exercises in the next 3 or 4 minutes before I stop. And of course, step 3 is where you get into some sporting activity, so take up a sport. A sport can be dancing, it can be Zumba, it can be, it can be stuff like playing tennis. There's lots of stuff that people recommend that I don't. Anything that includes moving at high speed, I tend to not agree with. So I think I like to stay grounded, and I just mentioned that. And then you go on to muscle fitness or strength training, and the simplest things like, just push-ups, squats, those are the simplest. But honestly speaking, I generally advise people take up weightlifting. Weightlifting doesn't have to be, the Olympic weightlifting kind of thing. That's not what I'm talking about. But just have a pair of dumbbells. Have a pair of dumbbells of different weights, and do weights for your arms, your forearms, the shoulders. Do weights, carry weights and squat. And you'll be amazed that if you keep doing these things, your physical performance will not deteriorate. I mean, obviously, it will be harder than when one was younger. But if you start safe, start small, and progress gradually, you'll be a new person in probably about, I think, 2 years. I think. I started exercising at the age of 45. And I remember when I did my first jog, I could hardly complete 1.5 kilometers. And for a week, I couldn't walk well. But, just persisting, about 3 or 4 years ago, I on a Saturday, I could do 20 kilometers nonstop. I regularly did 10 kilometers twice a week, once a week, particularly while I was in the UK. I don't know why it was easier then because of the weather. So it's amazing what one can do if you will just commit to it and do it on a regular basis. And because of that, I think is the reason why, I would still easily stand and operate for 8, 10, 12 hours and not die, So it does work. All right, so what are the key principles of exercise? 5 key principles. One is overload, progression, specificity, recuperation, and reversibility. I'll explain each one very quickly, just for those who might really want to get into it. So overload is a basic principle of physical conditioning that to improve your fitness, your body or specific muscle must be stressed beyond what it is usually exposed to. It has to be something more than what you do normally. So you can't, take up a 2 kilogram weight and say, I'm doing exercise. That's not exercise. That's not great exercise. It's got to be something that you have to put an extra amount of effort into. You don't have to do it the whole day. Your repetitions will be something between 8 and 12, but it should be something that stresses you. It should produce an effect. You should see that you have gone slightly beyond your limits. And it is that constantly stretching yourself further and longer that makes you fitter and fitter. So if you start running and you can do 20 minutes nonstop, you've got to push it further. And that's how it works. If you keep doing 20, 20, 20, 20, 20, 20, they'll get to a point where there's no benefit anymore because your body's that's like baseline. You're used to that. Progression is already something I've talked about. So overload needs to be increased gradually so that you keep stretching yourself and you keep attaining new heights. For progression, 10% rule is a safe rate of progression. So for weights, if you want to go up a weight, say you were using 5 kilograms, your next weight should not be more than maybe about 6 kilograms, so you don't want to jump from 5 to 10 kilograms because the risk of injury becomes more significant. Maintenance, exercising to sustain a desired level of physical fitness. And that's one of the maybe painful things about exercise is, of course, if you exercise for, say, 3-4 years, there's a significant amount that your body gains in terms of muscle mass, in terms of muscle strength, in terms of balance, endurance, flexibility. But the thing is that if you stop for a prolonged period, you start to lose those effects. So the only way to maintain that level of fitness will require some level of constant exercising. You may not take it beyond that, but to maintain that level of fitness, you will have to be doing some form of exercising. And if it was strength that you want to maintain, then you have to do some constant lifting. You may not want to go beyond a certain amount of weight, but at least that weight that you achieved, you have to make time to do it on a regular basis. Then this principle of specificity. And I learned this the hard way because you know how I used to run and I could run 10 kilometers and I got adjusted to that. And one day I thought, I'm going to just walk fast. I'm not going to run. And that's the day I realized that the muscles that I use for walking are actually a bit different from the muscles that I use for running, because it was a bit of a struggle to walk 10 kilometers. It was easier for me to run it than to walk it. And that's the same thing. I mean, and people talk about cross fitness, but cross fitness is not perfect. So you have to target some muscles. When I started running, I used to have a lot of hip pain. And I found out that my hip flexors were constantly strained and painful. So I had to start some exercises, sit up with weights. And once I started that just went away. And I could do my running and go further without any pain. So there's an answer to every little problem that will come along the way, Yep. And recuperation, body needs to recuperate. There needs to be recovery between exercise period. Sessions, particularly strenuous ones, and that recovery requires adequate feeding. You have to provide energy for that recuperation. You have to provide time to rest, and it's good to stretch a lot during that recovery period. Of course, the athletes now try to suppress or to hasten that recovery period by doing things like ice soaks and stuff like that. I don't think that is necessary. for the kind of exercise that, regular people do. And then, of course, overtraining is not a good thing. And that's what leads to injuries and persistent stiffness and soreness and all those sort of things, because there's not enough rest in between. For people over the age of 50, I think interval exercises are the best. Interval exercise is when you engage in an activity for a period of time. It's relatively not too long, say like you jog and you jog for 5 minutes, and then you stop and walk for 5 minutes, and then you jog for 5 minutes, and then you walk for 5 minutes. It allows the muscles and your cardiovascular system to adjust in a gradual fashion to longer periods of exercise. Exercise prescription is individualized, and that's why people get trainers. But honestly speaking, I think that if one is sensible and reasonable, you can always design something for yourself and can always talk to people. So most of your exercise should involve setting a goal. You should figure out the mode of exercise you need to do to achieve those goals. There should always be a warm-up period. There should be a cooling period after your exercise and stuff like that. Thank you. That's the end.
Thank you so much, Mr. Badmus.
You're welcome.
Dr. Badmus, can we show him some love? That's been a great, great session. Thank you so much. I can't see everybody else. Where's everybody else? Have you stopped sharing your screen, sir? Okay, I can see everybody now. Awesome. So that's been a great session, and I hope we have some questions for Dr. Badmus. So feel free to start raising your hands. I know you there's a button there. We are thanking you. We are thanking you. We're very grateful. Yes, Dr. Kemi Tuta. Yes.
Yeah, thank you very much. Good evening, everyone. Thank you, Dr. Badmus. It was really a very informative session. I've learned so much. God bless you, sir. Please, I have a question. You said something about the vitamin C and calcium, vitamin D and calcium. Please, I want to know how long the doses, and do we have any complications for long usage of those drugs? Thank you.
You're muted, sir. You can speak.
Okay, I was wondering if you wanted to get all the questions and I just answer them, or you want me to answer as the questions
One
asked?
by one is fine. Yeah.
Okay. All right. So vitamin D and calcium are their standard daily requirements for all human beings. The doses that we've discussed, which is about 500 units of vitamin D and about 500 milligrams of calcium, would be something that you can use the rest of your life. This will not give any problems by itself. Maybe in some individuals who have certain conditions, but that would be something else. So it's completely safe. Some people need to take higher doses. And that's why I also mentioned, because vitamin D can be acid. Calcium is a little bit difficult to assay, because when you do a serum calcium test, what you are looking at is just the serum calcium is just calcium passing between different tissues. The real stuff, calcium, is in the bone. It's going to soft tissues and things like that. So there are obviously some people have low calcium in their serum, but that's a very small number. So vitamin D can be acid, and generally that the treatment for deficiencies or insufficiencies is significantly higher. And that's the one that then requires monitoring. When you use higher doses of vitamin D, that's when there's a risk of what we call hypervitaminosis. But for using 500 units daily, most of the supplements that are marketed would have somewhere in that range, slightly less than that. So yeah, that's something you can use the rest of your life, should use the rest of your life.
Okay. And just for clarification, that's above a particular age, not from when you're very young, isn't it?
Yeah, so we're talking about people in their over 50s or people who are postmenopausal, because some people's menopause comes in their early 40s. So postmenopausal women and people above the age of 50.
Yes. Okay. Thank you very much. And of course, for those that sit in offices all day, or those that work in temperate climes where there's no sunlight, it would be good to check your vitamin D or take a supplement because you're likely to be quite low in it.
Thank you for mentioning that. You know that using vitamin D and calcium also stops the decline that happens in winter. So ideally in winter, everyone in the UK should use vitamin D and calcium.
Yes. Probably a reason why some people have seasonal affective disorder. Okay. We'll take Dr. Adebusola Oyeride. We'll take you, Ma. We'll take you now, and then Dr. Oluwanuga next, and then Sister Pamaki. Yeah, over to you, Ma.
Thank you. Good afternoon, everyone. I'm very happy. Thank you, Doctor. You have actually enlightened us. I am newly retired, so this session is like you're actually talking to me, and I've really benefited a lot. Thank you very much. Now, you said bones get to heal. If I have cavity in my teeth, are they likely to heal by themselves?
That's a bit beyond my competence, but having said that, bone and teeth are different.
Okay.
They're different. I think you would need to talk to a dentist, but my feeling is that cavities in teeth do not repair themselves. And that's partly because they're being caused by something that is not going to go away. So bone is not being invaded by any germs. There's nothing. We're just talking about injuries. And bone is completely supplied by blood. There's no part of bone that is not supplied by blood. And that's the reason why it is living tissue. And the character of all living tissue is that when injured, they will attempt to heal in some way or the other. And bone has cells that will migrate to an area of injury to repair that injury to the best of their ability. Yeah.
Hey, thank you for that. All right, Dr. Oluwanuga, over to you, Ma.
Yeah, sorry, I was trying to unmute. Thank you so much. Thank you very much for that wonderful lecture, sir. I have learned a lot. I there's thing that I've been seen recently. They will say Tai Chi walking, Tai Chi walking. And I don't know whether you can enlighten us about this Tai Chi walking. I don't know whether it's something recommended. I also don't know whether it isn't something religious, which is why I haven't looked at it, because I, as a Christian, I'm not a believer in things like doing yoga. And the reason I haven't investigated it much is I'm wondering whether it isn't something related in that direction. Do you have any information about it you could please share? Thank you.
Unfortunately, no, ma. I don't know much about that at all.
Okay. Thank
In
you.
the media, anyway, I haven't investigated it thoroughly, but it's quite publicized. Tai Chi, one of the Oriental ways that people keep fit, and helps with flexibility and things like that.
Is that like yoga?
It's not specifically like yoga. It's not like a meditation practice. CIA and CHI. Yeah.
Okay, so yoga is potentially it's got two parts of it. So there's the meditation thing, but then in yoga there's the practice of posturing, and we actually recommend yoga exercises for back pain patients, along with swimming. I do know that, yes, because of the religion aspect of it, some people are not keen, but it's the exercise part of it. So that's why I wondered whether Tai Chi is something similar.
All right. Sister Bridget, did you have a question?
I have no questions. I just wanted to say hello to Dr. Badmus.
Is that she?
Yes.
Yes, sir.
Hi.
Good evening, sir.
Good to hear your voice. Good
Thank
evening.
you, sir. Yeah.
All right. We have Prof. I think it's Mami Adrian, one of them, has a question. You can speak, sir. You can unmute yourself.
Thank you very much, Doctor. We are really blessed. I'd like to know why I can't use calcium and pains in my bones since I was very young. And each time I use calcium, I start having pain all over my body. So I've been using glucosamine and chondroitin tablets all along. But you mentioned calcium that is very good for the bones. I'm in my 70s now, and still I can't use calcium.
Okay. You're muted, sir.
I'd like to know what is
Sorry, ma'am. Can I clarify? Did you say you have pain in your bones?
Yes. So she's had pain in the bones. And she says whenever she uses calcium, she has pain in her bones. So all she takes is glucosamine and chondroitin, and that she's in her 70s now. And what do you say about this?
Okay, so typically what we think is that high or low calcium levels is what causes bone pain, not the taking of the calcium. I've never had any experience with that or come across that in literature. So that might be something to look at. And of course, one would have to look at your bone health panel to understand what's really going on, because it does seem that you've had bone pain prior to trying to use calcium, and then you take calcium and you get more bone pain. That's sort of what I thought I had. Is that correct?
Mommy, you can unmute yourself. Did you hear the question? She says yes.
Oh, okay.
Network is not so good at her.
Yes.
Yes.
Okay. Okay. So can't really make a comment definitively about that now, but I presume that your calcium studies have been done, vitamin D levels, parathormone. They've looked at your X-rays. You've had DEXA scans. There are just quite a number of things that would need to look at to be able to say why you're having pain and what's best to do about it.
Thank you, sir. Now, there's something that you said that's raised some questions for me about.
I've done series of tests.
There's something that you said that raised some questions about you have to be doing exercise primarily for the reason of fitness to be considered doing exercise. Is that so?
Yes.
So if I
All the
say
going up and down people do for work is not exercise.
really? Walking to work, 15 minutes walk to work, 15 minutes back from work.
It is activities of daily living. It is physical activity, but it is not specifically exercise. Exercise has to be leisure activity that you engage in deliberately to improve your fitness.
Leisure. They decided not to take the bus and to walk briskly to work for 15 minutes. Why will we not consider that exercise? In this world with limited pressures and limited time, where is the time for it?
Well, there you go.
Okay, I think we have one more hand up. Mr. Kefad, you can unmute yourself. Let's hear your question.
Hello, everyone. My name is Kayode Fajimi Kefaj. Doctor, during your presentation, you talked about diabetes briefly. I just want to find out if regular exercise can control or reduce or even take off diabetes if one is having type 2.
Okay, sir. Thank you very much, sir. The answer to that is yes, 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 and yes. It may not control it for everyone because the human body from one person to another is different. There's a genetic basis for some diabetes. Some diabetes is a component of the metabolic syndrome. So if I try and explain it, so diabetes, control of blood sugar is primarily by a hormone called insulin, which is produced by the pancreas. So some diabetes is because the pancreas loses the cells that produce insulin and it's no longer producing insulin. Exercise on its own alone will not control that form of diabetes. It may help with the control in the sense, can you still hear me? Am I still on?
Yes, sir, we can hear you. Can hear you,
okay. It can help with the control in the sense that the target organ that glucose needs to go into is the muscles. Brain also uses glucose, but in terms of just the sheer size, the muscle has the best chance of absorbing the greatest amount of glucose. So the more developed one's muscles are, the better the target, the more the space for insulin to drive glucose into. Also, because when people engage in regular exercise over a prolonged period of time, their fat, the component, the level of fat in their body reduces. Fat creates resistance to insulin. And this is one of the reasons why people who are quite obese also tend to have problems with their blood sugar control. They have less tolerance to to sugar spikes. And that's because of the resistance to insulin. So losing weight is one of the recommendations for control of diabetes. Regular exercise has to be also considered an integral part of diabetes control, as is a right diet. And then on top of that is when you add the medications so that you are using the least amount of medications to control your blood sugar. That would be how to go about it. But I would not assume that exercise on its own will control all blood sugar problems. There will be some people whose blood sugar abnormalities is on a mild level and is largely because of poor muscle component, high fat content, that losing weight and exercise might just be enough. And
thank you very much for that, sir. I have about 2 questions more for you. One is about people that run, especially long distance running, like marathoners, about them developing things like micro trauma years later that affects them. I don't know whether you're familiar with this and what your thoughts are.
Yes.
And the second question is about, I know most of us are Africans here, but it's going on YouTube, but I want you to particularly speak to those in the African community. You know, when their child is small, they give them egg, they give them this, they say, oh, they are growing. And then as you get older, they think you should eat less meat, you should eat less this. What are your thoughts about that? Or they give just the father of the house to meat and the rest of the people manage.
I have no idea where that is coming from. Anyway, so long distance running. So, well, it's a bit of a complicated thing. And there are some studies that suggest that there's a bit of higher mortality in people who engage in marathons. I'm not sure that all the reasons are understood, but it does seem to be a cardiac issue. So there's a prescription for what the minimum level of exercising should be. There's a level of exercise you get to beyond which you don't really get much benefit anymore. So running a marathon is not really considered exercise. That is like something some people, it's an extreme sport, so to speak, you know. But I mean, people who do regularly do long distance running overall tend to live longer than people who don't. But yeah, some of them do experience sudden death and die young. Yeah.
Okay. And the second question?
Protein is very important for everyone. Protein is actually very, very important. I think where the challenge may come, I think, is that certain kinds of preparations of protein, as in literature over the years, been associated with an increased risk of cancer. So meats, grills, and I think that's where the problem is. But protein is important for maintaining muscle mass. The muscle is very important for longevity. People with poor muscle function have a greater risk of dying. So overall, maybe it's the sources of protein or the preparation of the protein that would be the issue. And of course, probably in most societies, protein is the more expensive part of the meal, which might be the reason why the breadwinners think it's their reward for hard work.
Okay, all right. I just also want you to say something about the fear about people going to the gym, just because there have been some people quite young as well that sometimes go to the gym and after that they just stop. And so some people are quite averse to it now. What are your thoughts about this? And then after that, your final words.
Well, going to the gym, I think the advantages and disadvantages to it, I think it's a personality thing as well. Some people like to do their things in front of other people. Some people don't. I do 95% of my exercises in my house. I prefer to build a gym in my house than to drive to a gym. But gyms have way more equipment. There's a lot more versatility. It's broader spectrum of what you can do in terms of exercise. The question is whether you can stay on your goal. If you remember, we talked about having your own goal and developing a plan for that goal and staying on that, understanding that everyone is doing a different race or trying to achieve a different goal. I think the challenge is that people see other people and then they want to do things that is not really for them. And so the risk of injuries is higher. When you go to gyms and you work with new equipment, you need to, first of all, learn how to use the equipment properly to reduce the risk of injury. You need to do your workout for yourself and not for an audience. So I think those are just human nature complexities overall. I don't have anything against going to the gym, but I do think that if you go to the gym, you should talk to the people that run the gym. There should be an instructor and you should take guidance, and don't use any machine until you are sure that you know how to safely use that machine. Any of those treadmills and stuff, anything can be very dangerous if it's not properly used. So that's it. Final comment would be just to say that no one is too old to start a fitness journey. Doesn't matter what one is going through. Exercise will improve your capacity to go through it better and to have a better outcome. And I think that's just because there are health challenges that everyone has. But with regards to blood pressure control, weight control, diabetes control, mood swings control, exercise just improves all of that. But it has to be regular. And some people can do that on their own. Some people need a group to motivate and to keep them going. Do whatever works for you and apply the principles right.
Thank you so much. And of course, we've been hugely encouraged hearing that you started at 45. So lots of us are very encouraged that it doesn't matter what age you are, you can still start and do very well with your exercise. Thank you so much, sir.
All right, pleasure.
Okay, thank you everybody for joining us. This is the Link family again. Big thank you to our speaker for tonight, consultant, orthopedic and spine surgeon, Dr. Olakunle Badmus. Big thank you to all of you for being an amazing audience. Thank you for your questions. And thank you for those that joined us on the YouTube channel as well. Please subscribe and share with others that you think would benefit from this session. I think it will be beneficial to everybody across board. And do invite others for the next session, which is going to be another very important one in the series, and it is polypharmacy in the aging and the elderly, which is a very, very important topic, and it's going to be taken by a pharmacist. So we're looking forward to that. That's going to be a great one. And so on that note, we'll bring this to a close. Sorry, we've gone beyond time a little bit. We're usually aiming to end the meeting about 6:30, but it's been a really engaging and wonderful session. And thank you, everyone. So on that note, we'll just say our motto together. If you can unmute yourself and it's not too noisy where you are, you can repeat after me. It's the Link family motto. I live in love.
I live in love.
I stay in peace.
I stay in peace.
I shine my lights.
I shine my light.
I use my power.
I use my power.
So help me.
I use my power.
So help me, God.
So help me, God.
Thank you, everyone.
Thank you.